Hi, my name is Amanda Menking. I'm an associate teaching professor in the Information School at University of Washington. Today I'm presenting a paper co-written with David McDonald, a professor in the Department of Human-Centered Design and Engineering at University of Washington. The title of our paper is Image Wishlist, Context and Images in Commons-Based Peer Production Communities. Before I begin, I'd like to note that this presentation contains images of topless women and discussions about female anatomy. Eva, a biomedical researcher in her 30s, started editing Wikipedia when she was searching for information about a surgery she was considering, breast reduction surgery. Eva used the search term breast hypertrophy, but when she read the breast hypertrophy article on Wikipedia, she was, in her own words, let down by its biased language. Eva was also bothered by the images used to illustrate the article. She said, quote, "It's not representative of the vast majority of women who get the surgery. I mean, obviously I didn't have breasts that were so big that I couldn't walk around," end quote. This paper is based on a subset of data that emerged from a larger study when I asked editors like Eva what kind of information about women's health is missing from Wikipedia. Almost every participant replied, images. For example, Elizabeth said, quote, "We really do need images, and we need high quality images. Many of our images that we're using on our anatomy content are really sexualized. They could very well be from porn stars or whatever. It just isn't appropriate to be used if the article is going to be used in a medical way. It really kind of downgrades us. I'm not opposed to showing vulvas with piercings and things, but when the majority of the images are pierced, and shaved, it just probably does not reflect the reality of most of the world," end quote. It's important for me to mention here that for an image to be used to illustrate an article on Wikipedia, the image must first be uploaded to Wikimedia Commons, which is often described as an amateur porn hub. So editors searching for images to illustrate female anatomy articles face limited choices unless they upload images to use. There are, however, barriers to contributing these kinds of medical images. As Kevin explained, quote, "You don't need signed consent for Wikipedia or Wikimedia, but you need signed consent for yourself. If you run into issues, the issue is going to be between you, the patient, and your College of Physicians and Surgeons, or whatever your licensing body is in your country. Many institutions are exceedingly conservative, and they have policies stating that you cannot take pictures for any purpose without our consent. That, of course, ends it for many people." In addition to professional risk, Kevin said contributing images can also come with personal risk, including harassment and lawsuits. Even when appropriate images are available, there are often disagreements between editors as to whether an image should be used, particularly when the image depicts a minor. As an editor of the breast hypertrophy article wrote on the article's talk page, quote, "I didn't remove the picture, though it appears somebody else did. I personally don't find the image offensive, but I think it is legally dubious. Although we do not censor, Wikipedia cannot and does not publish anything that is illegal in the state where the servers are based. If the girl is genuinely 15 years old and the image does not portray gigantomastia, regardless of whether we may subjectively think about the image or whether or not it should be on the page, it is dangerously close to breaking the law, period. This is about legality, not morality," end quote. Monica, however, another editor I interviewed, said she didn't have a problem with images of, quote, "underage reproductive bits," end quote, on Wikipedia, pointing out that her medical textbooks are full of them. We found that a kind of dissipation of sociality and diffusion of information further complicates matters. For example, Wiki Project Women's Health, a project site where editors might learn how to illustrate female anatomy in women's health articles, is, as one participant noted, quote, "pretty much dead in the water," end quote. And although Wiki Project Medicine and Commons provide guidance about sexualized images, nudity, and consent, there's a lack of consistent documentation about how to illustrate these kinds of articles and to what aim. We argue that the process of decontextualization and recontextualization that occurs when images are removed from their original context, uploaded into Wikimedia Commons, and then incorporated into articles on Wikipedia underlies these challenges. Decontextualization and recontextualization prompts editors and readers alike to ask, what is it? Who's the audience for it? Who gets to decide? There are then three key takeaways from our paper. The first I've spoken about in the most detail. The illustration of female anatomy and women's health information on Wikipedia poses unique challenges. This is partly due to the female body being both objectified and demonized for centuries, but it is also due to the ways in which Wikipedia is technically intertwined with Wikimedia Commons and with the norms and practices of both communities. I've only alluded to the second key takeaway, which is that Wikimedia Commons is understudied. Despite Erickson and colleagues' 2018 finding that images from Commons generated an estimated 28.9 billion in downstream use, few people have chosen to study Commons. Finally, our third key takeaway is that the decontextualization and subsequent recontextualization of certain forms of media in commons-based peer production communities comes at a higher cost than previously assumed. In many ways, the prevailing argument around commons-based production has been lower costs to the system, but our study challenges this notion, finding distinctly higher costs where images are concerned. We want to thank our study participants for sharing their time, expertise, and experiences with us. Finally, I'd like to thank you for listening. Thank you.